who have investigated in the 1854 cholera outbreak London. It is identified the contaminated water it is source. What is the component of epidemiology? What is the distribution? The study of disease frequently according to the time, study of disease, uh, short-term changes, a seasonal variation, long-term trends. The, it is a epidemiology main theme. What is the aims of and objectives of these epidemiology? First one is describe the health status and population to identify the epidemiological factors, the study of nature in history to the disease, to evaluate the prevent and therapeutic measures, to provide the data planning to measure management uh, resources, to identify the emerging health problem. This is a main objectives of the epidemiology. What is the nature and history of disease? The pre-pathogenesis phase, it is no symptom phase interaction between the agent, host, and environment. The pathogenic phase is the early subclinical stage, clinical stage. It outcomes of recovery, disabilities, and death. What is the outcome of these pathogenesis stage? Recovery stage is happen, and disability stage is happen, and death phase is death causes it to be happen. What is the levels of the prevention of epidemiology diseases? Uh, primordial prevention emergency risk factor is high. The primary prevention is preventing onset the disease. What is the major part of these epidemiology is infection disease epidemiology. What is the infection? I will share you slides. What is the infections? Infection is the entry and development of the multiplication of an infectious agent in the body of man and animals, causing the diseases. What is the contamination? Contamination is the to the presence of infection agent on the body surface, a cloth, surgical instrument, or other substances like water, milk, and food. What is the population? What is the pollution? Sorry, pollution. The presence of offensive and but not necessarily to infection matter in the environment. What is the infectious? Infection means it is lodgement of the development and reproduction of the arthropods or some surface of the body of human and animals. What is a host? Host is a person or animal that after to the substance or lodgement to the infection agents under the natural conditions obligate to the host means the only host for the particular infectious agents. What is the definitive host? Definitive host means what is the primary host? Definitive host means primary host. Host is the which is the parasite attains to the maturity or passes its sexual stage. What is the intermediate? Intermediate means secondary host. Host is which is a parasitic in a sexual stage of development. Transport host. Transport host. It is a carried in the which the organism remains alive but does not the undergo the multiplication. Infectious disease. Infectious disease clinically manifest diseases, human animals, resulting for the infectious. Contagious contagious diseases. Diseases. Disease that transmitted through the contacts. Example, scabies like that. What is the communicable diseases? An illness due to a specific infection agent capable of being or direct or indirect transmitted from the man to man, animal to man, from the environmental through the air, dust, water, food to the man and animals. What is the epidemic? Epidemic, it refers to the constant presence of the disease or infectious agent within the given geographical area. The population, area of our population group without information for the outside. Epidemic means it particularly one place. The disease caused to the particular place. What is a zoonotic? Zoonotic means it means that the infectious disease occurs in irregularly from the time to time and generally it infrequently. Endemic means epidemic affect to the large portion of the population and occurring over the wide geographical area such as a section or a national entire nation. It contained to the world. What a zoonosis? Zoonosis means it is an infectious disease transmissible under the natural conditions from the vertebrates, animals to the man. Nosocomial infection is a hospital acquired. An infection originating person to the in the while the hospital or other healthcare facilities centers. What is the opportunity infections? Uh, What is the opportunistic infection means? It is infection as an organism that takes the opportunity to provide the defect to involve that infect the host and causes the disease. It is called particularly called opportunistic infection, but very common like AIDS. What is the disease classification or dynamics of disease transmission is communicable diseases are the transmitted from the reservoir sources or infectious to the suspectable host. The source of infection that define the as a person, animal, object to substance from the which is infectious agent passes through or disseminated to the host. A reservoir is a definitely as a any person, animal, plant, soil, substances which is infectious agent lives in the multiple and resources. What is the reservoirs? Many of the what is the type of the reservoirs? Reservoirs infection. What is the type of reservoir? Human reservoir, animal reservoir, and non-living things reservoir. What is the human reservoir? All infection humans are the potential to source of infectious to the others. This disease producing the agent is leaving the body through the stool, vomiting, coughing, sneezing, other means like potentially capable infectious other persons. Usually, after the recovery from the infectious diseases, there will be not be disease producing organism man body, but some diseases the disease agent is not completely eliminated, leading to the carrier stage. A carrier stage is defined as any infectious person or animal that specific infection agent in the absence of describable clinical and disease and serves to as a potential source of the infection to the for the others. What's the animal reservoir? Animal reservoir which is suffer from the an infectious act to the carrier may be potential source of the infection humans. Uh, the disease which are the transmittable from the vertebrate to the humans. That is called as the zoonosis, the rabies, yellow fever, like that only. What is the reservoir or non-living things? Soil, soil emanate the matter can act as a reservoir of the infections. For example, soil may uh, some herbal agents cause to the anthrax, tetanus, and gases, some other uh, infections. What is the route of transmission? The communicable diseases may be transmitted from the reservoir source infection to a suspectable person to various ways, depending upon the infection agents portal of entire the local academic condition. What is the direct transmission? Direct transmission is direct contact to the transmission. Droplet infection, contact with the soil, bite an animal. These all are the direct transmission. What is the indirect transmission means? Vehicle borne, vector borne. Vector borne means mechanical, biological, airborne, a droplet of nuclei, dust. These are the indirect transmission. What is the formative-borne diseases like waterborne transmission through the indirect transmission means waterborne transmission, contaminated drinking water, for example, chlorella happening for the these waterborne diseases. Foodborne transmission means contaminated food, for example, salmonellosis. Vector-borne transmission means spread to the infectious animals to the, for example, mosquito to malaria, fly to typhoid. These are the uh, trans indirect transmission. What is the airborne transmission means? Airborne transmission pathogens spread through the air. For example, tuberculosis, measles. What is the waterborne diseases? Waterborne diseases means waterborne disease caused by the pathogen transmitted through the contaminated water. Common waterborne diseases: chlorella, typhoid, dysentery, hepatitis, gastroenteritis. These are all the causes of the water. What are the cause of water contamination? Water contamination caused to the poor sanitation, open defecation, leakage of sewage system, improper disposal of the flooding and runoff, unsupported wells, water treatment. What are the remedial preventives of measures? These water treatment is remedial prevent measure of the uh, indirect transmission, filtration, sedimentation, chlorination. These are all the transmission level of safety to the epidemiology. But epidemiology studies disease patterns in population. Disease occurs due to the infection agent to the host and environment. Waterborne diseases spread through the contaminated water. But prevention depends on the safe water and sanitation hygiene process. These are all the waterborne diseases. What are the, for example, what's the infection? Infection is the entry to the growth of multiplication of the microorganisms like bacteria, virus, parasites, and to the body. It may be causing to the disease when the symptoms appear and become infectious diseases. For example, tuberculosis infection, tuberculosis infection in lungs, viral infection in the causing the influenza. What the contamination refers to the presence of harmful microorganisms substances on the surface of the water, food, and other organisms. These all are the basic infection diseases. What is the what is the pandemic condition? What is the the pandemic condition of the these epidemiology? What is the water contamination? Water contamination means the prevention of water contamination. Preventing water contamination is essential to the protect of the public health and reducing the waterborne diseases effectively. Uh, The effective prevention to the involves a source of the participation, proper treatment, and disinfection to the and safe and waste disposal. Protecting the water safeguard to the well and springs, reservoir from the pollution. I keep watering resources away from the latrines, septic tanks, and drains. This one, what's the proper willings and willings to the cover the following for the wells, fencing around the water sources, prevented entry of the surface runoff water to the animals' waste materials. What is the treating of the water? What is the treating of the water? Rainwater must be treated before the distribution, main step to the sedimentation, filtration, disinfection. So disinfection, these are all the happening the before to the spread. Sedimentation, settling the suspended particular particle. Filtration means removal of the impurities. Disinfection means killing the harmful microorganisms. Household treatment method, boiling. Basically, household treatment method using to the boil the water, using the filters and solar disinfections. What is the chlorination? Chlorination means adding the chlorine to the water to kill the pathogens. The most common effective method to the disinfection. What is the form of the chlorine used to the bleaching powder, chlorine gas, chlorine tablets. What are the benefits of these chlorination? Means kill the bacteria and virus. It provides the residual protection during the distribution. What is the proper sewage disposal? The safe and disposal of the human waste prevents the contamination of the water sources, essential for the method to the proper sewage system. What septic tank is a rural areas wastewater treatment. It is contaminated to the water. So, what is the avoid the open defecation and discharge from the untreated sewage water to the water body. This is all the prevention of contamination to the water. What is the biological analysis of the water? Biological analysis of the water due to the determination of microbial quality of the water. It is helps to detect the contamination by the human and animal fecal matter. So, which means it may be carry the disease causing the organism. It instead of the testing for the every pathogen indicate for the organism of use to the these bacteria indicate the presence of and type of presence and type of the contamination. What's the E. coli? E. coli, E. coli, a coliform bacterium. E. coli, coliform bacterium normally found in the uh, in instance of the instance of the human body. It is a warm-blooded animal. It is a warm-blooded animal. The presence in the water has indicated the fecal contamination. What is the significance? This pollute. What is the pollution contamination in the water? This E. coli is also uh, primary indicator of the recent fecal pollution. What is suggested to the possible presence of the chlorella, typhoid, a dysentery pathogen? Drinking water will contain the 0 to E. coli as per the 100 ml. Um, Streptococci, Clostridium. These all are the contaminated to the water. What is the causing agent? Causative agent is the acute diarrhea. Diarrheal disease can be caused by the three main group of the pathogens. Viral cause the common viral agent, retrovirus, adenovirus, like that. The bacterial cause to the common bacterial agent, Vibrio cholera, Salmonella, E. coli, like that only. Pathogen causes the pathogenic agents like Entomobacter, Giardia, dysentery maybe. Contaminated food is properly cooked. The contaminated drinking water, unsafe and untreated water. What is the contaminated food? Improperly cooked or stored food, a food handled with unclean hands. But these all the what are the common symptoms of these? Are frequently lose water stools, vomiting, abdominal cramps, fever, diarrhea, thirsty, dry mouth, sickness eyes, reducing the urine production. What is the prevention method of the safe and drinking water means with the proper sanitation and sewage disposal, hand washing with the soaps, hand washing with the soap, and so safe food handling and storage. Control the files and use the oral dehydration ORS drilling lines. Um, use and drink the ORS. These all the prevention and control of the control method of the epidemiology. What are the epidemiology terms? Epidemiology, the basic terms of essential for the understanding the occurrence of the spread to the impact of the diseases in population. These basic terms are the essential for the understanding the occurrence and spread and impact of the disease in a population. This is called the epidemiology. This what is the prevalence? The prevalence refers to as the total number of existing causes of both new and old of the disease in population at the specific time. What is the types of these prevalences? The prevalence is the number of cases at the particular point of the time. The period prevalence is the number of causing during the specific period. The period means number of causing during specific period. What is the point prevalence? In number of causes at the particular point of the at the time. And this is called the prevalence. What is the incidence? Means incidence is referred to as the number of new cases of the disease occurring in a population during the specific period. This is called the incidence. Incubation period. Incubation, the time to interval between the entry of the pathogen into the body, appearance of the first symptom. Example, the chlorella few hours to 5 days. The incubation period of the chlorella is few hours to 5 days. Typhoid 7 to 14 days. Hepatitis A 2 to 6 weeks. What is the importance? It helps in the disease causing diagnosis. What is important in these like help in the disease diagnosis, quarantine measures, contact tracing. What is the mortality and morbidity rates of the mortality and morbidity refers to the number of deaths in the population during the specific time. It is called a morbidity rate is referred to as a number of people affected to the by the diseases illness causes is a population. What is the indicate this type of indicate the rate of prevalence and rate importance of the indicate the level of illness in a community helps to planning to the health services. What is the outbreak investigation of the epidemiology? Identify the source, determination the origin of the infection. Steps include confirmation of the diagnosis, collecting the patient history, identify the common exposures. The laboratory testing helps to detect the causing agent, tracing the source of prevent further cases. For example, the identification of contaminated water supply during the cholera outbreak. Control transmission. What is the control transmission? The break in the chain uh, infections method to depend on the mode of transmission. What is the key measure of these outbreak investigation? Isolated the infected individuals, treating the cause, treating cases, the promptly disinfection of contaminated sources, improving the sanitation and hygiene. Mm, the vector control is, if applicable, the vector control is happening. What is the main goal of this? Stop stop the disease from the spreading to others. Protect the product. What is the product of the suspected population? Is reducing the number of population people at the risk of infection. Protective measures, vaccination campaigning, distributing the safe drinking water, health education or hygiene is conduct the health awareness program, health education give to the people, use the protective equipment and where the needed. What is the outcome of this? Lower infectious rates and preventive our future of outbreaking. This is a method. What is the typhoid? Typhoid fever. Typhoid fever is a water and foodborne diseases, infectious disease caused by the bacterium Salmonella typhi. It spread mainly through the fecal or oral route, especially in areas of with the poor sanitation and unsafe drinking water in places. What is transmission? What is the typhoid transmission sources? Typhoid infection is occurring happening in the a person consuming the food, water contaminated with the fecal matter contain the bacteria. The common source of the including contaminated milk. Milk can be become a contaminated during the improper handling, mixed with the contaminated water, unhygienic storage, storage of milk and water. Uh, and pasteurized milk culls is a common risk of the contaminated of the typhoid. What the contaminated vegetables or raw vegetables may be carry the bacteria when the washed with the contaminated water, grow in a field, investigate with the sewage. This is all of the typhoid. What are the key symptoms of the prolonged typhoid? Prolonged high fever, headache, weakness and fatigue, abdominal pain, loss of appetite. Sometimes you see the rose spots. What is the prevention method of these typhoid? Drink safe water or safe milk, treated water like treated water, pasteurized milk. Boil the pasteurized milk. Yes. Wash and cook the vegetables properly. Avoid the raw and under cooked shellfish. Practices the good and hygiene conditions. Take the typhoid vaccination in the risk areas. What's the main theme of this typhoid? Typhoid is spread through the contaminated food or water. The common source of milk, vegetables, shellfishes, like uh, prevention depends upon the safe water, proper food handling, and sanitation. These are the typhoid method. What is the cholera? Cholera means cholera is a acute waterborne bacterial disease caused by the Vibrio cholera. It is characterized by the an acute waterborne characterized by the sudden onset, profuse watery diarrhea, and can lead to the severe dehydration and death if untreated. Cholera is acute waterborne bacterial disease. So, what is the explosive outbreaks? The cholera often the occurring the explosive outbreak, large number of the cases appearing within the short period. The common in areas with the poor sanitation, neutral disaster zones, refuse cramps. This rapid spread to the occurring due to the contaminated water sources. What is the transmission to the contaminated water and food spread to the through the fecal oral route only. The infectious occurs by the consuming the contaminated drinking water, improper cooked food, food handled with the unclean hands. What is the common source of these cholera is polluted wells, surface water, street foods prepared with unsafe water. What are the requires of the sanitation and hygiene? The control and prevention of the depending the improper sanitation and hygiene. What are the key measures of these? This is the safe drinking water, boiling or contaminant, proper sewage disposal, hand washing with the soap, safe food preparation, rapid treatment with the ORS and medical care. These are the cholera cycle. What is the main summary of these cholera? Cholera causes with the rapid exposure outbreaks spread to through the contaminated water, food, like that only, controlled by the safe water and sanitation, hygiene, and prompt treatment. What is the animal reserve? The bacteria are they commonly found in the intestine of the animals, especially poultry like chicken or turkeys. cattle, sheep, domesticated pets. These animals act as a reservoir without showing the symptoms. The bacteria are shared with the animal faces contaminate the environment. What is spread to these spread to the via contaminated food, water, infection occur to the fecal and oral route, consuming the common sources. What the common source of these animal reservoirs are raw and unpatched undercooked poultry, raw and unpatched milk, contaminated drinking water, food cross contaminated during the preparation. What are the symptoms of these? Diarrhea, abdominal cramps, fever, nausea, and vomiting. These symptoms usually appear in some 2, 3, 5 days after infections. What is the prevention of the Campylobacter? The cook poultry through properly avoiding unpatched milk, safe drinking water. These are all the common factors of the Campylobacter. What is the bacteriology of water? Bacteriology of water deals with the microbial examination of the water to determine that it's safe and for the drinking and domestic uses. Since testing for the all pathogen is difficult to the indicator of bacteria are used to the as the water quality. Coliform test. Coliform bacteria are indicated from the organisms that suggested the fecal contamination. What is the common indicators of the coliform test? Is E. coli, fecal streptococci. What is the purpose of these bacterial of the water, bacteriology of water, the coliform test? Detect the presence of the fecal pollution, indicate the potential presence of the disease causing the pathogens. What are the common coliform tests? The multiple tube of fermentation test, estimated number of the coliforms in the water. What are the membranes of the filtration test? The water filtration is and bacteria are contaminated counted with the culture media. What is the platelet count? Platelet count also called as the standard plate count (SPC). The measure to the total number of viable bacteria in water. What is the procedure? Procedure is the water sample is cultured on a nutrient agar, incubated under the controlled condition. Colonies counted and expressed as a colony forming unit for the ml. Significant. It indicates of the general bacterial load helps to access effective water treatment, quality, and distribution of the system. Water quality standards. Water quality standards define as a acceptable the microbial limits for the drinking water. Typically, bacteriology standards WHO as per the WHO. E. coli as per the 0 for the 100 ml of drinking water. The total coliform should be absent in treated water. The plate count, low bacterial count indicate the good quality. The purpose of standards, what is ensure the water safety, prevent the waterborne diseases, monitoring the treatment efficiency. What is the summary of these? The coliform test fecal indicate to the detect the contamination. Platelet count, the measure the total viable bacteria, overall water quality. What are the standards of the acceptable limits ensuring the safe and drinking water? These are all the bacteriology of water. What is the summary of these epidemiology? Epidemiology is the study of the distribution, causes, and patterns of the disease like population. It helps to understanding the how disease spread, identify the risk factor, the planning prevention control the measures. Many infectious diseases, especially waterborne diseases, are linked into the unsafe drinking water, poor sanitation, personal hygiene, safe drinking water. What indicate that these all the to epidemiology. Safe drinking water, proper sanitation, good hygiene practices are the most effective method for the epidemiology, preventing a disease transmission, reducing the outbreak, protecting the community health. These are all the epidemiology method. The next one is we are talking about the other occupational hazards. I will share you something. Occupational hazards. Occupational hazards. I will give you one slide. Please wait. This is occupational hazards are the risk or dangerous to the workers may be faced during the course of their framework their work. These hazards can affect to the physical, chemical, biological, economical, or psychological health of the workers. This is a common name of the occupational hazards. What is the definition of these? This one is physical hazards. Physical hazards arise from the environmental factors that can harmful to the body without necessity of the touching it. The physical hazards arise from the environmental factor that can harm the body without the necessity of the touching it. Example: noise, vibrations, radiation, poor lighting, slippery floors, electrical hazards. What's the health effect of these occupational hazards? Mean hearing loss. The effect to the hearing loss, heat stroke or hypothermia, burns, eye strains, injuries from the fall, the shocks. What are the chemical hazards? These chemical hazards occur due to the exposures to the harmful chemicals in the workplace. What is the source of these chemical hazards? The source of chemical hazards is gases like carbon monoxide, chlorine, like that. What is the vapors? Vapors like solvents, paints. What is the dust? Silica dust, coal dust, fumes like metal fumes, liquids like acid, pesticides. What are the health effects of these chemical hazards? Uh, Skin irritation, respiratory disease like poison, cancer, organ damage. These are all happening in the chemical hazard. What is the biological hazards? Biological hazards are caused by the exposure to living organism, their byproducts. Examples: bacteria, viruses, fungi, parasites, insects. What is the common occupational risk? Healthcare workers, laboratory staff, farmers, waste handlers. What are the health effects of these biological hazard to the people? Health effects: infectious diseases, allergic reaction, skin infection. These are all the biological. What is the psycho or ergonomic hazards? These hazards result from the pure workplace design from the improper work practices. For example, poor posture, heavy lifting, awkward body position, prolonged standing condition. This what is the effects of these particular situation? Causing the back pain, joint problems, muscle strain, uh, some other diseases. Okay, psychological hazards. Psychosocial hazards means these hazards are related to the workplace stress and mental health condition factors. Example: work overload, long working hours, job insecurity, workplace harassment, lack of control of the work. What is the health effect of these psychosocial hazards? uh, stress. They are facing the stress, anxiety, depression, burnout, reducing the productivity. What are the mechanical hazards? These hazards are caused by the machineries or equipment. Example, moving machines part, like sharp tools, falling objectives, conveyor belt. These are all the chemical hazards. Moving to the machine, sharp falling to the objective, conveyors. What is the prevention and controlling measure of these mechanical hazards? Prevention of the one mechanical hazards is engineering controls, machine gardening, proper ventilation, noise reduction, safe equipment design, administrative control, safe training and workplace, the proper PPE kits, means helmets, all these. What the definition of the occupational uh, hazardous means? Occupational hazardous are the risk to or dangerous present in the workplace that can be harmful to the health safety or well-being of the worker. These hazards may be arise from the nature of the job at the working environment. Tools, materials, or the work practices. What are the risk factors of these faced in the workplaces? Workers are exposed to the physical, chemical, and biological and socio-psychological risk to the humans. Hazardous may be immediate or long-term disease causing diseases. The level of risk is depends upon the type of occupation during the exposure, safety measures. What are the safety measures are in the place? The common various in sectors, occupational hazards are found in across the many of work environmental industries, agriculture and other chemical industries also, mining industry. What is the health effects? Occupational health effects hazardous lead to the short-term effects, cuts, burns, and some other body stress, uh, poisoning, heat extinction, allergic reactions. What are the long-term effects mean? Chronic respiratory diseases, hearing loss, skin disorders, cancer. These are all the occupational hazardous mean. What are the chemical hazards? The chemical hazards arise from the exposure to the harmful substances in the solid, liquid, gases, and vapor dust. What are the common source of the industrial chemicals, pesticides, fertilizers, solvent paints, toxic gases, fumes, dust? What are the health effects of the chemical hazards? Means skin irritation, burns, respiratory diseases, poisoning, organ damage, cancer. But the main effects of the occupational risk is the factory workers, laboratory farmers. These are the uh, mm, chemical hazards. Okay. The solid liquid, what is the present as a solid liquid gases in the hazardous can occur the different physical forms. So solids, dust, powders like a silica, asbestos, gold dust. What is the liquid acids, solvent and pesticides. Gases vapor means carbon monoxide like that only. What's the control using of these chemical exposure limits? Workplace safety is maintain the setting the flexibility of limits. These limits define as a maximum concentration of the chemical a workplace can be exploited safely. What are the methods of control? Engineering controls, ventilation, closed system. Uh, Administration controls means work rotation, safety procedure. Personal equipment means PPE, respiratory gloves and glasses. These are the chemical hazardous health stresses. What is the main theme of the these are psychosocial hazards? What are the effects of the psychosocial hazards affect the mental and emotional and physical health of the workers? Prolonged exposures to the stress, jobs insecurity, and poor working conditions can be lead to the several health behavioral problems. Major effects of the fatigue, the continuous stress, long working hours causes to the physical and mental exhaustion. Reduce the concentration and work efficiency, increasing the risk of workplace accident. Insomnia. Insomnia means stress to and irregular work schedule for the disturbing the normal sleep. Insomnia is stress and irregular work schedule to disturbing the normal sleep the pattern. It's common among the night shift workers and high pressure jobs. What are the effects of the pure sleep? Daytime drowsiness, reducing the alternates, uh, reducing the alertness, pure decision making. What is the nervousness? Nervousness means the patient stress load to the anxiety, irritability, and emotional instability. The workers may be feel the tense to worried or the unable to be relaxed. What is the possible outcome? They decrease the productivity, conflict with the co-workers. What is the reduced and job satisfaction? Peptic ulcers. Uh, Chronic stress to increase in the stomach acid, it may be contribute the ulcer formation. Often associated with the high pressuric jobs, irregular meals, shift workers. This is happening in the psychosocial hazardness. What are the symptoms of these? Burning of the stomach pain, nausea, indigestion. What urgentism? The workers may be frequently miss the work due to the stress-related illness, lack of motivation leads to the reproduce productivity, increase in the work for the others. Organizational loss. This is the main organizational loss. Industrial environment. The industrial environment refers to the surrounding in around the industrial activity, including the natural and living components by affected by the industrial operation. What are the key factors of this industrial environment, including the air, water, soil, and other organisms? The industrial environment consists of the air quality affected by the emissions of the gas, dust, and fumes. Water quality may be contaminated with the industrial effluent and chemicals. What is the soil? Soil can be accumulated with the heavy metals, chemicals, and waste. What are the living organisms, plants, animals, and human affected by the population? What are the industrial activities interact with the components influencing the ecosystem and human health? Industrial growth and causes of the pollution. Industrial growth, rapid industrial can lead to the air pollution, smoke pollution like smoke, particulate matter, or toxic gases. Water pollution like a discharge of untreated industrial water to enter into the environment. To the soil pollution dumping to the soil and hazardous waste into the environment. Noise pollution from the machineries and transport mechanism. What is the consequence of these? One is a environmental degradation, loss of biodiversity, occupation and community health problems. What is the standard protect workers and environment? So, to the reduce the risk, government and agencies set to the environmental occupational safety standards. Example, protective measures, emissions and fluents limits their set the releasing point of the emissions and effluent limits, waste management regulations, workplace exposure limits, the safety protocols and monitoring sectors is also. Purpose of the standards, the protect the workers' health, prevent the environmental damage, ensure the suitable industrial growth. What is the summary of these industrial environmental? The industrial environment include the air, water, soil, and living organism. Industrial growth can lead to the various forms of the pollution. A regulatory standard and safety practices help to protect the both workers and environment. This is the industrial environmental. What is the air quality? Quality control. Well, air quality control refers to the measure that taken monitoring of the regulator improve the soil quality and air quality and industrial air and urban air. It is essential for the promoting the protecting the human health and workers and the environment. What are the key concept of this? Monitoring the air pollution levels, identifying the pollution sources, setting the air quality standards, implementing the control technologies, enforcing the environmental regulation. What are the common air pollutants? Particulate matter, sulfur dioxide, carbon, nitrous oxide, carbon monoxide, ozone. What are the best practices means practical means approaches? The best practical means approach is using the most effective possible methods to control the pollution. Principle of the best practical means the using the available technology, cost effective pollution control, practical and achievable measures, continues the improvement. These are the what is the alert level of pollutants? The air quality system often the using the levels of one to the public and workers when pollution extend safe limits. The process of providing the early warning, protecting the vulnerable groups of these is the major uh, air quality controlling method. What is the water quality standards are regulatory limits to set up the water quality, water discharge industries from the protective nature and water bodies. What are the key points of this? This is water quality is the water quality standards vary according to the type of industry and natural waste system. This is linked with the effective and standard. mm, What is the link to effective standards? Some water quality standards are closely connected with the effluent discharge standards. The common parameters mentioned with the below pH, biological oxygen, and chemical oxygen demand, suspended soils, heavy metals, oil grease. These are what is the purpose of this water quality standard? Ensure that treated water meets to the safe and discharge limits to the prevent the toxic and substances entering to the water bodies. Prot- uh, Protect the receiving water body. The standards are designed with a protected rivers, lakes, groundwater, and aquatic life. They help to maintain the safe drinking water source, healthy aquatic ecosystem. This is the water quality standards. What is the toxicity? Toxicity is the ability to ability of the chemical substance to cause harm to living organism, including the humans and animals and plants. This is what is the summary of the toxicity? Toxicity is the harm to causing potential of the chemicals depends of the main dose route of the duration exposure to understanding the toxicity help to the exposure limit safety standards. What is the case study of the case study of cement industry? The cement industry is a major industrial sector that uses the material raw and material and involves in the process of that can create the significant dust pollution affecting to the workers and surrounding to the environment. What is the raw material? The primary raw material used to the cement manufacture is the limestone, main source of the calcium carbonate. What is the clay? Provides the silica, alumina, and iron oxides. This is what is the manufacturing process of cement? Cement is producing the main two methods: wet process and dry process. The wet process means raw material are grounded with the water from the slurry. The slurry fed into the rotary kiln. High temperature converting the mixture of the clinkers. The clinker is cooled and grounded with the gypsum to the produce the cement. This is the wet process. Dry process means dry materials are crushed with ground into the fine powder, and the dry powder is fed with into the rotary cling. The clicker and formed to the cool and grounded with the gypsum. What is the major issue of dust? The dust generation in the primary occupational and environmental hazard to the cement plants. What are the health effects on workers? Respiratory irritation, chronic bronchitis, and pneumonia, eye and skin irritation. What are the control measures? Control measure where the maintain the mask, no, use the personal protective method, so they reducing the dust particle. Control measurings of the industrial environmental. The controlling method to the use the reduce eliminate the pollutants in the industrial workplace. These measures can help to protect to the environmental and surroundings. What is the main summary of the occupational hazards? Occupational hazards affect to the workers' health and occupational hazards are risk prevent to the workplace. They can cause injuries, acute illness, chronic diseases, mental health problems. The both and short term and long term exposures can harm to the workers. But the four main categories of the hazardous occupational hazardous by the broadly classified into chemical hazardous, physical hazardous, biological hazardous, psychosocial hazardous. What is the chemical hazardous? Chemical hazardous caused by the dust, gases, solvents, heavy metals cause poisoning, respiratory diseases like a cancer. What is the physical hazard? Physical noise, vibrations, radiations, heat, pure lightning causes the injuries, burns, hearing loss, and fatigue. Biological hazards means bacteria, virus, parasites, fungi. Fungi causes the infectious diseases. So, psychosocial hazardous means it works just to the shift the worker job opportunity, causes the fatigue, anxiety, absenteeism. This is the importance of the controlling measure. What is the importance of the controlling measures of these occupational hazards? Safety standards help to limit the worker and ensure to the hazardous. The controlling measure reduce the risk of the source. What are the key approaches? Engineering, what is engineering controls like a vegetation, a filters, machine guards. What administration control means? Training, work rotation, What is the personal protective hygiene equipments like PPT? What is the goal of these occupational hazards? The protect to the work health, prevent the occupational diseases, ensure the safe and sustainable workplace. This is the occupational hazards. Uh, Epidemiology and occupational hygiene is today class is over. Thank you very much.